There were a group of tourists, about 150 of them, who were in the ship from Argentina going to Cape Verde. But along the way, they visited a lot of islands, especially where there's bird watching. And when they were going to St. Helena, there is a gentleman, a 70-year-old, who fell ill. And when they arrived in St. Helena trying to help him, unfortunately, he passed. He's from the Netherlands. His wife was flown to OR Tambo in order to fly back home because she could no longer be on the ship. And she was not sick, but when she arrived at OR Tambo, she collapsed. And they took her to hospital, where unfortunately she passed. The third one is a British gentleman between St. Helena and Ascension. He fell ill, and when he arrived in Ascension, they airlifted him to South Africa, where he's in a private hospital. He's the first one who was confirmed to have this Hantavirus.
Just to also be clear that usually the hantaviruses most often are not usually spread human to human. Most of the viruses, I'll clarify now. So most of the viruses are normally transmitted through rodent droppings and it's usually in specific kinds of environments. There is a less common variant that occurs in South America that is associated with human-to-human transmission. And based on the Argentinian history, etc., and the travel history of these individuals, we will still do the confirmation to see whether it is a South American variant. But on the history, it looks like it's very likely to be that one. And that one, they can be transmitted from person to person.
So initially it's very non-specific, unfortunately. You might have some muscle aches, almost like flu-like symptoms, fever, abdominal pain. If they do get worse or they don't respond to your usual conservative management, that's when you want to seek help, especially if you've been at risk or have been exposed. It's generally when we would seek help anyways, isn't it? So non-specific at first. If there are complications that occur, it can have respiratory symptoms, shortness of breath, or you can even have a bleeding tendency. But those are generally the complications that develop later on, and by then hopefully you're already in the healthcare system.